All right, well, good morning, everybody, and thank you for joining us today. My name is Jonathan Underline with the Fight for Our Health campaign, and this is a press conference really intended to help emphasize and highlight the voices of folks who are going to be impacted by the proposed Republican cuts to Medi-Cal, Medicaid. And I'm going to kick things over to Yasmin to kind of start things off.
Good morning, everyone. Thank you for joining this press conference today to highlight the impact that the proposed federal Medicaid cuts would have on older Californians and people with disabilities who rely on Medi-Cal. My name is Yasmin Peled, Director of California Government Affairs with Justice and Aging. Justice and Aging is an advocacy organization fighting to eradicate senior poverty by ensuring access to affordable healthcare and economic security for low-income older adults. 2 weeks ago, House Republicans voted on a budget framework that opens the door to over $880 billion in cuts to Medicaid in order to fund tax cuts for the wealthy and corporations. In California, that would mean cutting billions of dollars from our Medi-Cal program. It is unconscionable that a small minority will benefit from these tax cuts while low-income older Californians will be left to worry about where they're going to live, how they're going to eat, and access quality health care. Many lawmakers are saying that these cuts will not hurt older adults. This could not be farther from the truth. Medi-Cal is a lifeline for over 2.3 million low-income older adults and people with disabilities in California. Medi-Cal helps to make their healthcare more affordable and accessible because, unfortunately, Medicare does not cover all of their needs. Medi-Cal pays for critical services like home and community-based services and personal care attendants, dental, vision, hearing, transportation, and mobility devices. These are all vital services that traditional Medicare does not cover. Over 900,000 older adults and people with disabilities rely on Medi-Cal to cover their long-term services and supports, like the in-home supportive services program and long-term stays in nursing homes. Medicare does not offer this coverage. Over 1.75 million older adults and people with disabilities in California rely on Medi-Cal to make Medicare more affordable. Medicare is very costly. There are high monthly premiums, and for every doctor or specialist visit, people have to pay 20% out of pocket, not to mention copays and deductibles. Medi-Cal pays those costs for low-income seniors and people with disabilities. Without Medi-Cal's financial assistance, seniors could not afford Medicare. So a cut to Medi-Cal is a cut to Medicare. Today, California receives over $112 billion in federal funds for our Medi-Cal program. The cuts being proposed at the federal level would mean that our Medi-Cal program would lose tens of billions of dollars, an amount that the state would be unable to backfill. If these federal cuts are passed, state policymakers will be left with very difficult decisions to make in order to keep the state budget balanced. Major cuts to eligibility and benefits in Medi-Cal are almost inevitable. Today, you'll hear from medical providers, home care providers, family members, and seniors on Medi-Cal about the importance of Medi-Cal coverage and how devastating federal cuts would be. I'm pleased to introduce our first speakers today, April Hall and Charity Martinez, mother and daughter from Hanford who rely on Medi-Cal.
Good morning. My name is Charity Martinez. My mother is standing here right beside me. I've been caring for her since 2021 and been able to get her the Medi-Cal that she is be able to pay for her medicine, as well as her doctors, her co-pays, as well as IHSS, which has been able to give her the care that she needs for her everyday function. So it allows her to receive the care that she needs for her daily living.
I'm April Hall. I'm Charity's mom, and I depend on Medi-Cal to pay for my IHSS and all my doctor's appointments with
Your incontinence supply.
oh, my incontinence supplies, anything that that Medi-Cal pays for, I need, and it's like anything that I have to be responsible with all the doctors, and my daughter has to be, needs help with taking me to doctor's appointments, and understanding that I I have to have this to pay for my medication, my supplies, doctor's appointments, co-pays, anything and everything.
Fantastic. Thank you.
Thank you so much, April and Charity. Next, we'll hear from Sherry Horn, the mayor of Laguna Woods, who depends on Medi-Cal to care for her husband.
Sherry, we need to come off mute.
Okay, my husband has a chronic ongoing condition, and we were doing fine until last year he was hospitalized. And the bills from hospitalization were huge, in addition to his medication and everything. And it was they wanted to put him in a rehabilitation center, but we really couldn't afford that. So I applied for Medi-Cal and food assistance, and we were approved, and Medi-Cal has changed our lives. I mean, they pay for any future hospitalization, any nursing home, any there's daycare centers. We can afford now our non-medical supplies, and I've applied for IHSS so that I can get paid a little bit as a caregiver, because we rely on our Social Security. That's all we have is our Social Security and a small paycheck from City Hall. So it's been wonderful to be able to eat twice a day and to have nutritious food and be able to pay for our medications and not have to choose between one and the other. And it would be devastating to lose this because Medi-Cal also pays Medicare Part B costs, which puts a little bit more money that we can afford medical devices for my husband. So I don't know what we would do without it. I would hate the idea of losing my home, and I need to live in this city. I don't want to move out. So we really, really hope that they keep Medi-Cal and the food assistance that we rely on to live every day. Thank you.
Thank you so much, Sherry. Next, I'd like to introduce Lawrence Waterman, a home care worker from Lake Elsinore.
Yeah, thank you. My name is Lawrence Waterman, and I live in Lake Elsinore. I have two daughters. Both of them are disabled. One is on the autism spectrum. She's got bipolar disorder as well as ADHD. My other daughter has what is known as spinal muscular atrophy, which is a form of muscular dystrophy, and it's related to ALS. I've been taking care of my daughters now for 18 years with the help of IHSS. I'm a single father, and the importance of IHSS is it helps us to be able to have my daughters living in the home, me being able to take care of them and provide them with all the needs that they might have. Whereas if somebody else came in, they may not get the same kind of care. And it's been very helpful. And the impact without having Medi-Cal or IHSS services could impact many families in a bad way. If you had a parent that was in a home that was being taken care of and they ended the Medi-Cal or Medicaid program, they wouldn't get that help. That means that it might be on you to bring your parent who is getting good care to bring them in your home. You might have to quit your job to take care of them. It's going to put a financial burden on a lot of people, and it's not right. The money's there. We just need them to keep it going. The financial struggles for me would be the fact that right now I'm putting food on the table. I'm retired. I get Social Security, but you know, we just get through. We're not asking for much. The work that we do and the care that we give is not the same kind of care that your loved ones might get from someone else. And our politicians need to put themselves in our shoes and think for a moment what it would be like if they had this awesome responsibility to take care of their loved ones. So I'm just calling for Senator Calvert to think about what he's doing. He's been voted in by his constituents, and he is obligated to his constituents. So I just want him to hear what we have to say. So that's all I've got to give. Oh, I just do want to add one more thing, that how much I like doing what I do because I'm there with my kids. I've been fortunate to watch them grow. And I urge everyone to support IHSS providers and protect Medi-Cal so we can continue caring for the most vulnerable members of our communities. Thank you.
Thank you so much, Lawrence. Next, we'll hear from Dr. Lauren Alving, a neurologist from Fresno who serves older Medi-Cal patients in the Central Valley.
Thank you, Yasmin. Good morning. I'm Dr. Lauren Alving, and I'm a neurologist. I run an Alzheimer's center in California's San Joaquin Valley, and I'm here to educate about what Medi-Cal is doing and what it means for my patients. My patients have many of the same burdens already expressed by our panelists. Low-income elderly patients rely on Medi-Cal to help support their medical care. And most of my patients have dementia, so caregiving and supervision is a huge issue for them. And as time goes on and the disease progresses, these patients need increasing amounts of assistance, support, and supervision in addition to their basic health and medical care needs. Caregivers often need to help them or supervise them 24 hours a day, both for reasons of medical need and safety for those with severe memory problems. Families are forced to choose between working and providing that care, and sometimes working is the only financial option. So Medi-Cal providing support in the form of in-home supportive services, or IHSS, for very low-income patients is critical in helping keep patients living at home after they can no longer care for themselves. It's important, as pointed out by a previous panelist, that the support provided is not always exactly what's needed, but it does provide some help. As the dementia process progresses even further, the caregiving burden may become so great that the patients can no longer stay at home. And this is something that can happen very quickly, even when there's been planning in advance for this possibility. And Medi-Cal will pay for custodial nursing care for those who qualify financially. Something that was already mentioned is not covered by Medicare. And these types of decisions about nursing homes and that sort of thing are never easy, and they're often heart-wrenching for family members. But the support provided by Medi-Cal is crucial in allowing families to figure out what is best for their loved one. So for my patients, cutting Medi-Cal would result not only in difficulty accessing medical care for their many chronic diseases, such as high blood pressure and diabetes, but it would severely limit the support that their families receive to help keep them safe and healthy. And it makes sense that cutting Medi-Cal could increase emergency room visits as patients and families no longer have access to the care that they need outside the emergency room, causing increased stress on systems and ERs that are already overloaded. And finally, the people that would be hurt most are the ones who have the least other options, those with the lowest income. In the San Joaquin Valley, that includes many who live in our rural areas with fewer support services of any kind. The Fresno Bee indicated that 2.2 million people across the 8-county area of the San Joaquin Valley rely on Medi-Cal funding for their health care. any proposed cuts would present a severe medical, fiscal, and emotional burden on this most vulnerable population, and worse health outcomes would be expected. Thank you.
Thank you, Dr. Alving. And lastly, we'll hear from Kay Lee, Executive Director of the Healthy Aging Center in Laguna Woods and the Board President of the California Association for Adult Day Services.
Thank you, everyone. Hello, my name is Kay. I'm a CBAS provider. CBAS is Community-Based Adult Services. Community-Based Adult Services is a vital Medi-Cal funded program that frail older adults and persons with disabilities throughout California depend on. There are around 300 centers in the state, serving approximately 42,000 Medi-Cal recipients. Among these, there are 27 centers in Orange County, 8 centers in Riverside County, and 5 centers in Kern County. However, throughout the state, many of these CBAS centers have closed, and families are left scrambling with little to no options available for affordable care. This is just a precursor for the harm and chaos that will come if and when Medi-Cal funding is cut from the federal budget. As a CBAS provider in Orange County and Los Angeles County, I see firsthand how powerful and vital these programs are in protecting individuals and families from further harm and deterioration, and more importantly, empowering them to live within the communities of their choice. For many of our centers, almost the entire program is funded by Medi-Cal. So without this funding, countless participants and their families would be directly harmed, losing the vital support that they need to come into the center day in and day out, get skilled nursing care, social services, case management, nutritious meals, transportation, as well as therapeutic activities to maintain their health and well-being. We've learned time and time again that any and all Medi-Cal cuts directly result in our programs being cut. We aim to continue to support the older adult population, but these programs are continually on the chopping block whenever Medi-Cal is threatened. We know from experience that this elimination from the state Medi-Cal budget was attempted in both 2011 and 2020, and it was only overturned after intense advocacy and legal efforts by both the provider community as well as the CBAS participants and their families. Thus, any cuts would cause irreparable harm to an already fragile and precarious system that supports the most marginalized and underserved communities in our state.
Thank you so much, Kay. Thank you to all of our speakers today. As you've heard, Medi-Cal is a critical program here in California. For older adults, people with disabilities, and their families, Medi-Cal offers affordable healthcare and economic security that is vital. There is no way to carve out or shield older adults or people with disabilities from these proposed cuts. Everyone on Medi-Cal will be impacted, stripping millions of their vital healthcare and long-term care. We're happy to take questions now.
Yeah, if you have questions, you can put them in the chat or raise your hand. Antonio, I'm going to take you off mute.
Just thank you and good morning. This is Antonio Harvey for California Black Media. I just had a question. There was some numbers presented earlier in the presentation. How many people are affected by Medi-Cal in the state of California? And I don't know if I heard anything about some skill centers and things like that. How would that affect the skill centers for the senior adults too, if anybody can provide that information, please?
Sure. In total, there are 14 million Californians on Medi-Cal, but there are 2.3 million older adults and people with disabilities on Medi-Cal. And Kay, do you want to repeat the number of adult day centers?
Sure. There are approximately 300, give or take, throughout the state, and those 300 centers serve approximately 42,000 Medi-Cal participants.
You can keep asking questions, Tony.
Okay, okay, thank you. The gentleman who spoke about his 2 daughters, and it appears that he really needs this type of support. what can be done to prevent, an impact on him raising his daughter, since they severely need these type of fundings and resources? If anyone can answer that.
Lawrence, did you hear the question?
Oh, I can repeat it if necessary.
I'm sorry, what was the question?
Yes, yes. The gentleman who with the two daughters who was speaking.
That's me.
Yes, right. You said you been taking care of, your daughters for 18 years, but I want to, to ask specifically, to the experts on this call, how would that impact the funding? How would that impact your ability to continue to take care of your daughters if these resources are hampered in any type of way? What would you? What would they? What would be a second option if these?
There's not a lot of options, to be honest with you. And the other thing that UDW and IHSS has benefited me is that the money that I earn as a result of my work with my children, it doesn't go all in my pocket. It not at all. What it does is it also helps to subsidize our ability to put food on the table, just like a lot of other families. The work that we do, it's not for the money, but that money does help us to be able to keep the kids with us and also to be able to provide for them in many ways. Without the IHSS, my one daughter's in a wheelchair. She has to go outside of the county to get some of her services. And without those programs intact, she's not going to get it. And like a lot of other kids that are suffering, and I mean suffering, from a lot of their disabilities that are far worse than my daughters, they're gonna be the ones that are gonna pay the price. And all that's been there in the past. There's absolutely no reason why the money's not there now. I'm so tired of hearing these people telling us we don't have enough money. That's not true. That's what they want. They've been trying to get rid of Medicaid, Medi-Cal, and Social Security since those programs were in existence.
I would like to chime in. My name's Charity Martinez, and I take care of my mom. I was the one that spoke in the beginning. I could tell you in particular with our situation that started in 2021. My mom had no other opportunity. It was a nursing home of her having to pay $3,000 out of pocket. That's with Medi-Cal. And unfortunately, I was the only opportunity for her to come live with me and for us to figure it out together, because otherwise she would be homeless. She was confused. She weighed only 120 pounds. She didn't even know her name. We were in and out of the hospitals. Hospitals were throwing her out in a wheelchair and saying I didn't know what to do with this. And I had to drive 3.5 hours just to save my mom on the road because the doctors, including Mecca, would not help her. After paying for 60 years of working 3 jobs and contributing to Social Security, they couldn't even help her. So that's where I had to come in to protect my mom, to get her off the streets. So without IHSS, both of us would be homeless. Sorry for the frustrations.
Yeah, I'd just like to echo that. The families are funded through the Medicaid funds, and the help has been there. And it's like April said, there's going to be a lot of people that will be put out on the street because they're trying to take care of their loved ones at the same time, put food on the table and pay their mortgage. And they can't do everything. Some things are not possible. And the last thing we need are more homeless people.
Which the Valley already has a huge epidemic with the homeless. If you can see, people have already, thousands of people you could talk to on the streets right now currently that's already lost their home. And IHSS only pays $17.25 here in Hanford. And so that little much, you can imagine with a pack of eggs, $10 to $15 for a pack of eggs, $7 for milk. And my mom only receives $900 a month. So you can imagine the poverty that she would be living.
Thank you. Yeah, and this is basically my last question too, because I'm hearing from a lot of home providers. If anyone has any numbers or can send it to me as well, how many providers in the state, uh, of the providers who, take care of a family member or, you know, a child or children or anything like that, how many providers estimated in the state that take care of the, individuals as these people are talking right now?
I'm not sure if you're able to
Yeah,
answer
well,
that, Lawrence.
yeah, I'm sorry. It seems like with the individuals, online right now, they take care of their family members 24 hours a day. So I just want to know, do you have a number on how many providers in the state that take care of, a family member or children or, someone who needs assistance?
Yeah, I think Antonio, we'll have Yasmin follow up with you
Okay,
with those numbers.
I would appreciate it. All right, that's what.
Absolutely. Thank
All
you
right.
so much.
Anything to help the article. Thank you.
Thank you. Yeah, absolutely. And we'll send you can you leave your email address in the
Yeah, I'll give you the short version, and then when you contact me, I'll give you the business one. ARAYHARVEY @yahoo.com. That's A Ray Harvey, HARVEY at
Mhm.
yahoo.com. I'm a capital correspondent for California Black Media. And one of my beats is working on senior adult care. And if I just preface the fact that, I know that these things is going to affect these individuals. So I've been
Absolutely.
working on these for a few years. Thank you.
Yes, absolutely. Well, you'll get an email from Yasmin with the numbers, and we'll also be sending a press release that will have some quotes and some data in it as well as a link to the recording. So keep an eye out for an email from us today.
Absolutely. Absolutely. Thank you.
Thank you. We have a couple more questions in the chat here. We have one from Jim Gallagher. Question is, what is the overall strategy to stop the cuts? What and who at the state level are organizing to the best of your knowledge? Maybe Kieran, you can take this one.
Yes, I can take that question. Thank you for that, Jim. So I would say one thing that's really important to know about, I think, this issue and Medi-Cal is that it is extremely popular in the state of California and across the state, across party lines. This is not a program that Californians of any political persuasion want to see cut, and they have made that very clear in large numbers. And so the overall strategy, right, is to demonstrate that these are real people behind the dollars that congressional Republicans are talking about. This is all of us. These are our lives, right? These are real people. And the reason that Medi-Cal is so popular, or Medicaid nationally is so popular, is because most people know someone who benefits from the program, right? And who relies on the program. And so this is something that is woven into the fabric of our state and our country. And the Fight for Our Health Coalition is a big, broad coalition, consumers, labor, healthcare providers who you've heard from today, child advocates, senior advocates, a big, broad coalition because so many people are impacted by this program throughout the state. And then there's also a question here from Anthony Victoria. If cuts are expected, are there any measures at the state level to provide temporary support for families on Medi-Cal? The answer is no. 2/3 of our Medi-Cal program approximately is funded through federal dollars. There is no backfill in the state of California. The state of California pays our taxes to the federal government with the understanding that programs that Californians rely on will be supported. And therefore, the federal funding has to continue to come to support those programs. There really is no alternative. Also, as Lawrence described, this is what Californians rely on. This is what Californians pay for. There is no alternative. Our Republican colleagues really need to understand the impact of this program and the impact of their proposal. And then there's also a question about specifically California District 41. We can send you some information about that. I would say I believe it's about $3 billion of Medicaid money that goes into that district. And so it's really significant both for the people and for the local economy.
Anthony, are you able to, if you can, put your email address in the chat here so we can follow up with you on those specific points? And then the final question that we have is from, I believe, from, oh, I thought I saw one from Jessica asking about the state of the budget right now. Jessica, I assume you're referring to the votes in Washington, D.C. I don't know, Kieran or Yasmin, Kieran, maybe you can take this one too.
Yeah, so the status is that congressional Republicans, including all of California's Republicans in our congressional delegation, cast a vote to move forward a budget framework that would cut nearly $1 trillion out of Medicaid nationally over the next 10 years. That is an unacceptable vote for people who represent districts where a majority of people rely on Medi-Cal, like Congressman Valadao, as well as those who represent districts that maybe have fewer people who rely on Medi-Cal, but where it is just as necessary for people who are particularly vulnerable. So they did vote to advance that. And as you've heard today, that is a harmful vote. That is unacceptable. And there are many more steps in the process. And so they have an opportunity to rectify that vote and to really stand up for Medicaid going forward throughout the federal budget reconciliation process, and to withhold their vote for any budget proposal that would negatively impact Californians by cutting Medicaid or other vital safety net services. Yasmin, do you want to add anything?
Nope, I think you covered it. It's an ongoing process. The vote 2 weeks ago was the first step in the process, but there's more to go.
Great. Well, I think that covers it for questions. And yeah, thank you to all the members of the media and everyone else who joined the call today to hear from these individuals who, are really facing a serious situation if Republicans in DC decide to go through with these cuts to Medi-Cal. But I think that that wraps up the press conference. Thanks everyone for joining, and we will be following up with a press release, including a link to the Zoom recording, as well as some of the data points that individuals have asked for in the chat. So thank you again.